It's tough. It's a tough ride, but it's sustainable. And I think that the measures that have been taken so far are relevant for this situation.
As Quebec Public Health sounded the alarm over rising cases and hospitalizations, Dr. Luc Boileau maintained that the province is unlikely to bring back COVID measures like a curfew, but is warning people to remain vigilant.
The virus is still very contagious in the community. It's spreading again. There's a lot of people, many thousands every day, so they have to they have to be very careful with that, and in particular for the elderly people or people that are at risk.
With hospitalizations for the virus now at above 2,000 patients and over 12,000 healthcare workers absent from the system for COVID-19 related reasons like preventative withdrawal, isolation, or awaiting test results, there are delays, with some appointments being postponed. But Dr. Luc Boileau says it's not being adopted as a general province-wide policy, rather on a case-by-case basis. Public Health adding that many are expected to come down with colds and flus in the coming days as Quebec deals with the delayed flu season, and Omicron symptoms often present like that of a common cold.
It's quite unusual to have a flu season in April, yet this is what we're facing right now. And this is somehow expected because when we lift the public health measures, well, other viruses are going to be coming around. And since influenza and other viruses were not around for about 2 years, 3 years, then there might be some catching up on their part for infections. So right now, this is the reason why it's so important, especially for the gathering, upcoming Easter, Passover, etc., to be very clear. If you have symptoms, no matter how mild it is, it could just be a sore throat. Don't visit your relative, especially if they're vulnerable. So very important, no matter, even if your COVID test is negative, it could be flu, it could be something else, it could be just it's not positive yet. Stay home, isolate.
Among eligible Quebecers, 54% have received a third dose of the vaccine so far. Fourth doses in the province are now open to those 60 plus, as well as the immunocompromised. But Dr. Luc Boileau understanding why some may be stalling in getting their boosters.
They feel that if they are well protected with 2 doses, because in fact they are protected, but not as good as with third dose. The other thing is that they expect it to be a mild disease, which is the case for a lot of them, and in particular if they have been vaccinated before. But for some of them, it's a tough ride, and especially if you haven't had the chance to be vaccinated at all.
As religious holidays have begun, many are expected to come together. Public Health reminding people of the risks.
We're not suggesting not to gather, we're suggesting to do so, being conscious of the risk and being careful with who we are going to meet, and make sure that no one has symptoms or recently had or had an infection a week ago saying that I'm completely okay, I have no symptoms since 3 days, I don't do fever anymore, it's perfect, or it was very mild, no problem, it lasted for 2 days. No. 10 days, so we have to be careful. We can be in good shape, but the virus can be contagious for 10 days. Keep that in mind.
In Montreal, Brittany Henriques, City News.